Good Wednesday. Happy Wednesday, Mount family members. We thank you for joining us today. We're going to do something a little different on this Wednesday. We've been letting you know that as a part of our Choose Healthy Life United Way partnership, also working with Mount Carmel Baptist Church, we have committed to, for 2 months, be advocates for vaccinations in our area, and we've been doing it every opportunity we get, whether it's prayer calls or Bible study or Sunday mornings or emails or text messages. We've been trying to encourage our members and our friends to get the vaccination, to get vaccinated. And so today, as a part of a 3-part series, we are going to take a few minutes on this Wednesday to talk about vaccinations. And we have our friend, our fellow colleague here at the Mount in Ministry, Dr. Shantelle Brown, the founder of Hope Pharmacy. And hopefully you guys know that Dr. Brown's a part of our family. And if you can, get over and to support Hope Pharmacy and the work that Dr. Brown is doing there. She definitely has been a huge part of making sure that people get the vaccine this year in 2021. So we're thankful. And we're glad that we can sit here with her today and to hear her thoughts on why people need to be vaccinated, et cetera. So thank you, Dr. Brown. And just for the sake of our members and those who may watch this later, tell our watching audience, just tell them who you are. You know, who is Shantelle Brown, and where, maybe some experience about growing up here, maybe what school you went to. Tell us what you would love to, for us to know. And then, more importantly, what led you to be the first African-American woman to start a pharmacy and here in this region.
Greetings, 6 Mount Zion. Thank you for having me, Pastor Reverend Butler. A little bit about me. I want to kind of give some insight on how Hope Pharmacy all began. But starting out, I did attend Henrico County Public Schools. I graduated from Howard University with my doctorate of pharmacy degree. And I came back to Richmond, and I started working with an independent, Dr. Leonard Edlow. And I actually had more years training with him than I did work with him. I knew that I needed to step outside of the area that I was in, which was a predominantly African-American area. I would say almost 99%. If they weren't African-American, they were of Asian descent, and that's because they owned a store in that area. And so I knew in order for me to grow, I needed to step outside of where I was, around the people who I'd been. And so I stepped out. I went to UCrops for years. And I tell everyone that's where I really learned how to be a pharmacist. At Edlow's, I was behind Dr. Edlow, and, I just worked. I didn't have to be put on front, but there at UCrops I did. I learned how to lead. I learned how to counsel and really take care of patients and see their needs and their wants. Totally different from where I started with Dr. Edlow, but it all helped me really build and develop to what I needed for Hope Pharmacy. So after leaving UCrops, I was with Sam's Club. Many of you know, because I have quite a few who were there with me at Sam's Club that have joined me here at Hope Pharmacy. And so with the management skills that I learned from Sam's Club, and now having to own my own, that all of those things, I always say, it has become full circle for me. I've been able to utilize all those things and experiences and skills in order to open my own and have my own. And it's been a blessing. It is a faith walk, but I believe that with anything, especially with finances, it all happens in cycles. I believe that there's going to be seasons when it's going to be plentiful and seasons when it's not. And when it is plentiful, what do you do with it? I do believe in tithing. I do believe in giving an offering. And so those things, I believe, have helped me and my family when I don't pay myself. But we still don't go without. There's still a bill that hasn't been late. Nothing's unpaid. Everybody's eating. My kids would know that, hey, mommy didn't pay herself. But I believe that that's all because of what I did when things were plentiful, when money was not an issue. And so I'm thankful. I can't say it's an issue now because it's not. We're still able to do and operate as we have. But that's a testimony for me of giving and doing what we should do as stewards of what he gives us.
So, Dr. Brown, you said a couple of things. First of all, everybody that's watching, if you send your kids in Rico County Public Schools, they can turn out like Dr. Brown. So, shout out to HCPS. So we appreciate being able to claim Dr. Brown and HCPS. Shout out to Dr. Leonard Edlow and everything he's offered up to our community over the years. And we've been talking about faith heroes here at 6 Mount Zion. So we're entering we're doing a series now. Those of you who watch, you know that we've been looking at Hebrews 11 and looking at all of these great leaders and persons that we look back on after the fact. And I feel like we are living amongst a faith hero, and we're talking to one today. It is, all of us who live in the East End. If you shopped at the Sam's Club on Laburnum, you were probably disappointed or frustrated or didn't understand. And you probably still don't understand sometimes why organizations make the decisions that they make. But the Sam's Club closing, I believe, pushed Dr. Brown to doing her own thing. And sometimes you got to believe in what you can't see to make it happen. So if you don't mind, just talk to us, as we transition into this conversation about the vaccine and the impact of the pandemic and how has the global pandemic impacted you? How has it impacted your family? How has it impacted your work? I mean, we struggle. I was with a group of preachers last week, and one of the things that we talked about was we don't want to face it. We don't talk about it a lot, but the impact of the global pandemic on us is not just about our churches, but it's about us as human beings individually. And so, what have you felt? What have you heard? And how have you had to shift your business culture, I guess, because of the pandemic?
The pandemic, it has really had a major impact on my life, my family, and the business. Starting with myself, I believe that the impact, I believe that the vaccine, the pandemic, all of it has forced us to kind of think differently about life, think differently about how we interact with people. I believe sometimes God does do things to make us slow down. And this is one of the things I think he's done in my life, even though it's been crazy busy. But when I'm not working, the time is with my family. It's time for nothing else but them, and rest. And so we really had to center our lives differently with family first. And so I think that's, even though my husband and I, we both work for ourselves, the importance of family, putting them first, putting their needs first, that has impacted us tremendously. The business, we've had a great shift, actually. It has really impacted us in a way that some of the people and some of the new patients that we've had, I don't know that we would have had that. We've been able to go out into the community and reach numerous people, thousands of people who we hadn't seen or we may not have seen before. And so that has been great. I think for the community that I serve, Churchill is complicated. The demographics are very different. I believe, I call it serving new and old Churchill. And it's hard sometimes meeting everyone where they are when everyone is so different. But when you open up your pharmacy, your community room to the whole neighborhood, that gets them involved. That gets them wanting to be supportive, very thankful. They've all been very thankful for what we've done for the community and making sure that we had the vaccine there. I'll be honest with you, it wasn't easy getting the vaccine in Churchill. There were other areas that were deemed more important by some, and I had to really step out and say, hey, I don't want us to run out. We need it. At the very beginning, there was some mistruths about us as African Americans not wanting the vaccine. There are some people, and still to this day, who are hesitant. But the seniors that I know, I didn't come across maybe one or two who had questions. They just wanted access. And I had to make sure that the seniors in that area, the seniors even outside of that area, in groups and organizations that my husband and I belong to, that they had access because they were bypassed. How do we do that? We have to make some noise behind it. You have to get people who may not look like you to voice their views and their opinions and their support of you to make sure that you have what's needed for the community. And so that's what we did. And since I did that, we have not run out. We keep all three fully stocked. And so I am thankful for those who've advocated on my behalf.
So let's jump into it, because there are a lot of people out there in the region. We're about 70%, I think, first shot. 70% of this region have received at least the first shot. There's still 30% that haven't. So we're talking about, at this point now, two different groups. The group that is still unvaccinated, and now we're adding in the booster shot. So for those persons who may be watching, those people who may be apprehensive, just help us understand, what is the vaccine? And, how, whether it's Moderna, Pfizer, or Johnson & Johnson, how have the vaccines helped those who have been vaccinated? And then there are the cases where persons have been vaccinated and yet still get COVID. So if you can kind of talk to, from a medical perspective, what the vaccine has been able to do for the community and how is it benefiting us. And then the second part of that is, why should people get the booster shot?
So, Pastor, you bring up good points that I think we need to really discuss and dive into. And I think being in the community, having hands-on experience with people, it really helps, because you get to see so many different perspectives. You actually get to live out and experience what others have seen, what they're going through. And so I am definitely excited about being in the community to do that. And so when we think about the vaccine, and it's shifted, and I understand the hesitation behind it, because, it is something that's brand new. It is something that has, in my opinion, appeared to have been rushed, although it's been years and years in the making as far as messenger RNA vaccines. And so these vaccines, although it seems or appears that there isn't much information, there is quite a bit of information on the vaccine and how it's developed. I think we as a people oftentimes, when something's new, and it's not just us, I think statistics show now that we're getting the vaccine a little more readily than those who don't look like us. And I think once the politics gets out of it, if the politics move aside, I think we would be in a total different position than where we are. But it's going to come a day where this is a vaccine that's going to be mandated to get, as some people are now. I've spoken to different employers, and they're thinking about mandating it because it's very costly and people are dying, And so having that hands-on experience every day with people coming in and having the questions, being there, being able to journal my experience of all of the side effects or adverse reactions that could have occurred and may have occurred with myself. I was there to be an advocate or ambassador for the community. And so not until recently have I had to speak more on how the vaccine impacted me and my family. I can use as examples. And so we were able to give that information and share it with people. And yes, the vaccine, as with anything, it doesn't prevent you from getting the actual virus. So like the flu, for example, you can get the flu shot, but then you can still contract influenza. And so what it does do is help with symptoms. It helps keep you from out of being in the hospital, and it keeps you from dying. And so I tell everyone, the shot keeps you from dying, and that's what I truly believe. We have a close family friend who's on dialysis, and he contracted COVID. He had the shot. He walked out of the hospital a few weeks ago. And so I believe that had he not had it, things may have turned out a little bit different. And so we have to think about the overall picture and the benefits. How will this impact not only me, but everyone around me? And I think if we take ourselves out of this situation and scenario, it's totally different. This virus is not about us. It's about our kids. It's about our parents, our seniors. When we think about everyone else other than ourselves, I think we would be in a different position. For the boosters, I've had people who were vaccinated in January and February. September, I think maybe about in midsummer, they kind of opened up more, saying you didn't have to wear your mask. And around September, I started to see those same people vaccinated, then stop wearing a mask, and then they had COVID. They had mild symptoms, but they had it. And so I think once we take the mask off, until we develop herd immunity, then we still want to get these kids vaccinated first. I'm sorry to go back on that. I think before we take the mask off, once our kids are vaccinated, we can really begin to look at possibly being in a situation where, hey, you can take your mask off and feel comfortable enough to do so. But until then, I think we need to still stay masked up, especially in large events, people who we don't know. That's very important. But the booster, and I think there's been some misinformation or misunderstanding on how the booster works, as well as the third additional vaccine or third additional dose. We haven't spoken a lot on how they're different. So there's a third dose that can be given 28 days after your Pfizer or Moderna vaccine. Not with Johnson & Johnson. That hadn't been approved for a third additional dose. With that, if you are on any medication that causes your immune system to be weak, if you are a cancer patient, HIV patient, anything that classifies you to have a weakened immune system, you want to get a third dose. And that's not a booster dose, it's a third dose. And you're eligible for that 28 days after your second dose. Reason being, they believe that you're not building the immunity that's needed from the first dose. So that's different. So you don't have to wait the 6 months to get the booster dose. You can get your additional dose at 28 days after the second dose.
So let me ask you this real quick while you're talking about this. So this third dose, for persons that are listening, and are you suggesting that those who are in the position who may need it, first of all, their insurance probably will pay for it? And would you encourage them to go to their primary cares or whatever to make sure that they are eligible?
Definitely.
Okay.
So, and it's not about insurance with these vaccines. The vaccine is free. There are facilities, especially retail pharmacies, who the government has allowed to bill for administrative costs. So don't be alarmed. Some people go to the fairground or have gone to the fairground, or they'll go to a retail pharmacy and they'll say, hey, they didn't ask for my insurance card. But what has happened, the government has allowed pharmacies to, one, for the time, for any type of supplies that we use, we have to use our own. We have to pay for it. And so they've allowed us to be reimbursed for it. But still, no cost to you, so don't be alarmed with that. Even if you don't have insurance, it doesn't matter. You still get it. And guess what? The government will still reimburse the pharmacies for it. So we've been excited about that, to be able to make sure that there's no way no one is denied. So it's not an insurance issue. We just want you to be informed. We want you to know that if you have an autoimmune disease or on any type of autoimmune medication that would cause your system to be weakened, you do need that additional dose. I'm saying it wrong. The additional dose. The booster comes along 6 months after the second dose. And so what that does, it boosts that immune system up. It gives you that coverage that you need, just a little more. And so we've seen how it has helped us in the community really trigger in on those patients who definitely haven't worn their mask the whole time. They've been vaccinated, and now they're in a position to where they can actually become vaccinated and be fully covered.
So, Dr. Brown, you said a lot, and I know we are probably getting to a point where we need to wrap up, but there are a couple of points that I want to emphasize, because you said several things that are important. We are trying to combat misinformation here, and you started off by saying that there is, one of the things that you hear in the community, and I know some of you've heard it, that they were rushing this, they don't have the data on it. You said at the beginning that it may appear that way, but there has been testing previously done. That's one thing I want you to speak to, and just say it again. People need to hear that. And then the second thing is, and this is important, that people need to continue to still wear their mask when they are in environments where they don't know people, they don't know where other people have been, they're in large crowds. Really, it is better to wear your mask so that you can be safe than to not wear it and be unsafe. So if you can just reemphasize that. And then the third part of it is another fighting against, why am I going to get the shot when I know people got the shot and they still got COVID? The point is, the vaccine keeps you out of long stays in the hospital and dying. And some of the most critical cases, and I shared this from the pulpit like 2 weeks ago. 2 people that I know, one white, one black, neither got the vaccine, and they said it. If they could do it again, they get the vaccine, because the health complications of not having the vaccine. I've only known like 1 or 2 people who ended up in the hospital who got COVID and got the vaccine, but they also had some other underlying things going on. And so, if just help us again, because sometimes people need to, and they may not trust, it may go a long way hearing it from Dr. Brown that we need to.
I don't know.
Yeah, but the truth is, some people, they need to constantly be reaffirmed that the vaccine is worth it.
I think the only advantage I have, Pastor, is seeing it every day, is interacting with people every day who experience it, or they're taking care of someone who's experiencing it. And so I think that's my only real advantage. With this vaccine, especially with the messenger RNAs, the Johnson & Johnson, it works like the typical vaccine that we are used to. And I believe that had it not had the complications that it had with adverse reactions, I believe that we would be in a different position with Johnson & Johnson. 1 dose, I personally was a little leery about the 1 dose. I always believed that we possibly would have needed 2, but it would have given more coverage, at least some coverage, to those who were totally against it, who I know that, like homeless people, if I'm doing an event, that has still worked well for our homeless population, because you never know when you're going to see them again.
Yeah.
And so I think it would have done wonders for those who've been hesitant, those who don't like needles, and some of it is that. We class all of it together, but there are some people, we're able to look at their medication immunization records to see when we enter everything in, and they don't get vaccines. They haven't been vaccinated maybe since their childhood vaccines. And so getting a needle is leads to some fear for patients. And so that's another concern that people have. And, with this messenger RNA vaccine being in the making for so many years, I truly believe that, once the FDA, they've given their approval, I don't believe that from what I've seen, from what I've learned, and things change. That's another thing, another part of the hesitancy. Things change all the time, and it does, because we're learning as we're going. But the safety behind it. We talk about being able to carry children. I have patients who got their vaccine in January and February. They're due in November. So by no way of imagination are they not able to conceive because of the vaccine. That's another thing. And as parents, there's some concern. If I give my child this vaccine, how will it impact my kids? Will they be able to bear children? And so I hear that. That's probably my number one thing that I hear as it relates to the kids and having them vaccinated with this. But as you know, the schools, they make our kids get vaccinated if they want to be there now with other vaccines. And so, with the technology, with how things have really been able to speed and money, never have we had this much money put on something. So the more money that's been put out there in order to support these things and do the research and ramp up how the production is, the easier it is for them to get it done in a less amount of time. And so we have to look at that. Money, as some people say, rules the world. And in this case, money did have a big factor with how the production came about in such a rapid way. And so, I always listen not to just with the vaccines myself. I listen for certain things with Pfizer, with Moderna, making sure, because these companies, that's another thing. When else will they get this type of money at this amount this fast? So I listen to that. There are certain things I listen for with looking at the trials. What are you doing? We don't want you to rush out to say, hey, you need a booster just because you're going to make more money. We want to make sure that you're getting a booster because it's needed. What does it look like? Show me the trials. Let's research how many people were affected, what were their levels prior to, how was their immune responding to it prior to a booster versus not. So all those things we have to look at and really be educated and turn off the Google when it comes to this vaccine. Really research. Go to CDC, research what they've done. Check for yourself. When Google is out there, oftentimes it's what someone else's perspective. And so we have to really do the research ourselves. I don't even know if I've answered all your questions,
No,
Pastor.
I think you have, and I want to just ditto that. And that leads, because there's so many things out there. Some of the videos that I've seen have just been crazy. And African American communities are impacted. We got a lot of underlying conditions, and contracting COVID on top of it. The CDC, FDA. They both said that, there's nothing about this vaccine is going to alter your DNA. You still be able to have kids if you get the vaccine. And so there is, there's information out there that kind of supports that this vaccine is not going to do anything to you that will mess you up. So real short question. And then just, I'll come with a closing comment, but there are persons who may have some concerns about getting the flu shot and the COVID shot at the same time. What's your, expert opinion about that? Is it okay to get the flu shot and get my booster shot, or get the flu shot and the COVID shot at the same time?
It definitely is. So originally, there was, because of course we're learning as we go along, we had to wait 14 days before we gave a COVID vaccine with any other vaccine, whether it was shingles, pneumonia. We had to wait. But now they've tested, and it's safe to get both. I believe that it will actually help us with flu this season because we are there. We don't have to worry about coming back. Go ahead and ask your provider. Ask your pharmacist. While I'm here getting my booster or my first shot or my second shot, I still, by the way, Pastor, give first doses every single day. And so I get excited about that. And get it while you're there. Don't run away from it because I don't want you not to come back. But it is safe to get both. I've given up to 3 shots with the COVID vaccine, whether it's a pneumonia vaccine, flu, and COVID. So it's definitely safe. That's been tested. And again, we get information new all the time. So we have to stay on top of it so that we can answer those questions and help everyone make an informed decision about their health and combating these diseases that probably won't ever go away. There's going to be a strand of COVID probably always, as it is with influenza and pneumonia. And so we definitely want to try to combat those diseases with vaccines.
So, Dr. Brown, we thank you. We're going to wrap up here in a second. Dr. Shantelle Brown has been with us as our guest today, founder of Hope Pharmacy. And you can find her over on North 25th Street. Is that right? North 25th Street. Monday through Saturday. And if you have any questions, we're going to be on for a few minutes after this broadcast. And so if you have direct questions that you want to ask in a more intimate setting, maybe there's some questions that have been that you've hit us up in the chat. We'll try to answer those questions. Reminder, get on for prayer in the morning at 7 o'clock on Thursday. We're going to pray as we normally do, and devotions, etc. This Friday, we're not going to be here for the food pantry. We're usually not here on the 5th Friday of the month, so we're not here. But we will be here on Saturday. And a part of the reason why we run this broadcast on this Wednesday is because this Saturday, we are thankful that Dr. Brown has committed. Her and the whole pharmacy team will be here on the grounds from 12 to 2, giving out vaccines, first shots and booster shots. And so if you have not been vaccinated at all, we'll do it here at the church from 12 to 2 on Saturday. Or if you need a booster shot, we'll do it here from 12 to 2. You do not have to be a member of the 6 Mount Zion Baptist Church. You just need to fit into. And Dr. Brown, I'll let you close out whatever you want to say, and just maybe let folk know, because everybody doesn't get a booster shot, I don't think. So I think there's some specific check marks for that. So I'll let you speak to that. We're also having a Mount Market here, and so we have a partnership with Walmart. Walmart sends us home goods, and we are here on the ground Saturday to give those away. And then we'll also be doing a Harvest Fest giveaway for Harvest celebration on Saturday as well. So we've got a 3-in-1 event: Harvest, Trunk and Treat, whatever we want to call it, Mount Market, and then we're doing vaccines. Again, thank you. We're so glad that you're a part of our family here. We are so glad that you stepped out on faith and started Hope. And you have really been a stalwart in looking out for our community during this time. So if you don't mind just speaking to the check marks for booster shots, anything else you want to say as we conclude this broadcast. And then I'm going to tell you about those who are coming next.
Thank you, Pastor. First, on that Saturday, on this upcoming Saturday, we'll have all 3 vaccines. We'll have Johnson & Johnson, Moderna, and Pfizer. And as information comes out, we're going to make sure that we're on top of it so that we can give you what you need. And some of it makes sense. When I think about the Delta variant, right now, Moderna is giving the best coverage. Pfizer, but we don't know if other variants will come about and what that looks like. So some of us who've had Pfizer may want to get a Moderna vaccine for their booster. And so those are all the things that they're studying now. And it may be beneficial. I see the rationale behind it. I think it makes sense in my mind to be able to do both because they're made the exact same way. And so I will be able to give you that information and you can make that decision for yourselves. If at the conclusion, if you have questions about how it works, and it's complicated how the messenger RNA works, and I don't want to take up too much time going into the mechanism of action, but if you have those questions, I'm here for you, so we can go over it. We can draw pictures, however you need to understand it. That's why I'm here, and how it works, and how it will help us, and how it doesn't harm us.
Again, thank you, Doc, for being with us. We're looking forward to the event on Saturday from 12 to 2. During the month of November, we're going to hear from two more of our doctors here and as a part of the 6 Mount Zion Baptist Church. God has blessed us. We have several PhDs and EDDs who are part of our congregation who offer up themselves in different capacities. We're going to hear from Dr. Jessica Brown, who has authored a book about mental health and trauma as it relates to our life, and she's going to talk to us about how our mental health has been impacted and what we can do during this global pandemic. None of us have lived through it unless you are close to 100 years of age, and so this is all new to the majority of us. So we're looking forward to hearing from Dr. Brown and from Dr. Carla McLean, who has had experience as an emergency room physician and is now doing some health administration work and had some word to share with us as well. Hang on for a few minutes afterwards. If you want to have some questions answered specifically, we'll do that. So hang on. For those of you who normally watch Bible study and you do dial pad, 804-203-9011, all you got to do is just hang on. For those of you who are watching this by way of YouTube or Facebook or Twitter, then you're going to have to sign off and then call in, 804-203-9011, or you can do, I think, dialpad.com. But anyway, the instructions are right there on the screen. And follow those instructions and jump on. And we'll be on for a few minutes after the broadcast. And I thank you guys for joining us again. And again, prayer in the morning at 7 o'clock, 12 to 2 on Saturday, and then worship here at 10:45. God bless you guys. We love you, and we look forward to seeing you soon.